Hi, I'm Gautam Kulkarni. I'm a children's doctor in London, and welcome to my YouTube channel. This is going to be a super fun health education channel for parents, children, and even doctors. The health conditions covered are all inspired by real patient stories of children I've looked after over the last 25 years. I have a passion for education and recently published my first book aimed at children's doctors. Using AI based technology, I hope to keep you up to date with the help of my avatar, Doc GK.
It was probably my first independent night shift, as a doctor on the children's unit, nearly 25 years back. I froze in horror, as I was summoned urgently to the emergency room. It was the middle of a typical monsoon night in India where it rains non-stop. My patient, Seema, a girl about 12, took her last gasp, and stopped breathing. There was complete panic. Her mother was crying, and her father was pointing furiously. He walked to the corner of the room, and from a jute bag, removed the biggest cobra I had ever seen. Thankfully it was dead. It was clear that Seema had a cobra bite. I made sure our team was safe. Snakes, like many other reptiles, can retain their bite reflexes even hours after death. Frozen in panic, I tried to remember the advanced life support course I had completed that week. We sent an emergency call, as we were going to need all the help that we could. I remembered clearly my instructor explaining that in children, effective airway management is critical. Seema made no attempts at breathing despite stimulation. We opened her airway by performing an airway opening maneuver. Then we started administering her artificial breaths. Despite several attempts, we couldn't get effective chest expansion. The children's ward was in a separate block far away from the main hospital. It was the middle of the night, and with none of our team to help us, our senior nurse asked me to intubate her. Intubation is a procedure where we put a tube through the mouth into the airway, to keep it open. Having only watched a demonstration previously, I clumsily opened her mouth. One thing led to another and I had miraculously performed my first intubation. We had good chest movement now, as we connected the tube to an anesthetic bag. By this time we had more team members. We connected her to our old ventilator, and started her on fluids. We discussed how to treat her cobra bite. Anti-snake venom is the treatment for poisonous cobra bites. We started this immediately. Neostigmine is a medicine that can reverse respiratory failure and paralysis after a cobra bite. As the children's unit didn't have an intensive care unit, we shifted her to the adult ICU in the hospital. We visited her twice a day and hoped she would start breathing soon. After 5 days on the ventilator, Seema still showed no signs of breathing. In the developing world, a lack of resources means a constant pressure on ICU beds. The lead consultant warned us that if she didn't show any improvement by day 7, we would have to take her back to the children's unit to make space for another patient. Despite our protests, it was decided Seema was unlikely to make it. We were asked to take her back to the children's ward and withdraw life support. We connected her to a very old ventilator that we had on the ward. To her total astonishment, Seema started waking up after about 16 hours. Her breathing got stronger, and 5 days later, we discharged her home. She came back a month later for a review. Though she still had a nasty wound at the site of her bite, she was completely normal neurologically. Successful resuscitation is a team effort, and effective airway management is the most critical part of pediatric life support. Seema is now in her 40s, somewhere south of Mumbai. I developed a reputation for having magical powers in treating cobra bites. I have performed many procedures since, but my very first intubation that monsoon night will always be the highlight of my professional career. Thank you for watching. I would be delighted if you subscribe to my health channel.